Okay, everybody. I think we're gonna finish off on this one. This is gonna be a few more slides, and I know that last one is a little bit longer. But again, you've got full control over pacing yourself. I don't expect you to do all these in a day, or shoot, it's up to you guys. As you know, we're kind of nearing the end here. I'm getting the feeling that Gwynette's trying to tie things up quickly here. Again, exams are actually starting 3, 4 days earlier, a week earlier, generally speaking. So anyway, we'll just kind of go with it. You are going to have an assessment on this. It is going to be a test grade. But again, you've got the guided notes, and I started making the test today, and it's a little bit of everything: multiple choice, true, false, and even some short answer, and even a label, diagram label. But again, there's no need to worry or stress about that now. Okay, we'll deal with that later. Okay, so this I really believe that when we talked about reabsorption, that was the hardest part, and then of course, not that filtration and all that's easy, but whatever. Now we're really into, in my opinion, pretty straightforward, simple stuff. Okay, so if you were a little bit overwhelmed with the last couple lectures, this one will let you breathe a little bit. Okay, so what's it look like? So after filtration, and after reabsorption, and after secretion, after sodium's taken, and water's taken, and glucose, and ammonia, and all these different things, what are some of the characteristics that are left over? Okay, so what's it look like? It should be generally clear, okay, in tone, and pale to deep yellow. We've been over this so many times. If you drink water, your urine is clear. It's not right. It's not clear. It has no color. Clear is great. No color is not great. It's not supposed to be that way. I don't care what coach so and so told you. It's just not that. It's just not accurate. Should you hydrate? Yes. If you're sweating a lot, should you add the water? Yes. Even if you're not sweating a lot, you should still drink water. Yes. But having day to day, minute by minute urine that's colorless, that's just not the way it's supposed to be. And again, it's not urine that we're worried about. It's your blood pressure and blood volume that we're worried about. So anyway, I'm not going to preach to you about that anymore. The color is due to urochrome, which is a pigment that results because of hemoglobin, which is interesting because bilirubin, the other thing that causes pigment, is also because of destruction of red blood cells. So the color of these things, bile and feces and all that, actually comes from a lot of red blood cell destruction. The more concentrated the urine, the deeper the yellow color. That just makes sense. And then if you have some weird colors like pink or brown or a smokiness to it, may result from eating foods like beets or rhubarb, or maybe due to bile pigments or blood in the urine, which this last part, that's probably not good. But if you're eating rhubarb, by all means. Beets, no, only person I know eats beets is my grandmother-in-law and Miss Kleider. So go talk to them about eating that nastiness. Also, some drugs and vitamins may affect the color as well. For example, vitamin B12 actually makes it look like it's almost glowing. It's fluorescent. Um, and of course, if it's cloudy instead of clear, remember, it should be clear. If it's cloudy, it could mean that you got some sort of urinary tract infection brewing. But chances are, if you've got one, you are probably already know it because it hurts when you tinkle. That's rhubarb, and it's typically found they put it in a pie with strawberries. Kind of looks like red celery, in my opinion, but what do I know? Okay, anyways, it's sort of like a sour or bitter component. Anyway, for those of you, here you go. Next time you see it, buy it. Let me know how it tastes. Okay, the smell. This is out of your book. It is slightly aromatic, if you say so, but it should have some sort of smell to it. It does develop the ammonia odor. That's because of what's in it and the bacteria that start digesting it, and bacteria just chow down and do what they do to it. Um, Again, some drugs and vegetables like asparagus alter the usual odor, as do some diseases. Again, if you're eating asparagus, then you deserve all the smelly urine that you get because asparagus is disgusting. You probably already knew this. Diabetes actually makes the urine smell quote unquote fruity, but it's because of acetone. So, sort of like a chemically kind of smell, almost like a candy fruity smell. And again, that's because of uh, what the person's body is doing to the glucose. The pH As probably you already know, it's usually acidic. Most of you, if you have a dog or pet, you probably have a spot in the yard or two where all the grass is dead because they pee there all the time. The acidity of the urine just destroys the vegetation. But if you have a vegetarian diet, in other words, if you're starving, prolonged vomiting for some sort of infection or something, bacterial infection of the UTI, all these things can actually make the urine alkaline. That's basic. That's on the other side of the pH scale. And then this is good old chemistry stuff, maybe or maybe not. Every time I bring up chemistry, people usually moan and groan, and I miss that tremendously. But this is a kind of a science concept, and you can see the definition compares the weight of a substance to the weight of an equal volume of distilled water. Okay, in other words, basically everything gets compared to water. The specific gravity of water is one. The specific gravity of urine is a little bit heavier. In other words, urine will sink below water. Okay, that's it. So basically, it should be heavier than water. As far as what is in it, 95% water, and then the other parts are solutes. Most of it comes from urea, which is basically just, you can see right here, just basically your body working. Uric acid is also another solute in there, and creatinine, all these things again, which of course comes from basically your muscles working. These are all things, the main solutes, the largest things that actually give the extra weight to urine. And again, these are all things that can be measured with that renal clearance value we talked about, and they should all have certain values to them, certain ranges. Absolutely not. Okay. All right. So we're now going to get into the actual parts here. And there's, again, I told you this on the first day, I think, that this is the first unit and that we actually have to make a distinction between male and female. And it's not the kidneys, not the ureter, it's not the bladder, it's the urethra. Okay, the urethra in a male versus the urethra in a female, and we'll talk about that in a second. So you can see here in this cool slide that you've got the urine that's pouring down from all the different parts of the kidney, and then down the ureters here, and then this what seems to be a very full bladder at that point. Okay, most of you know something about dialysis. You've heard of it, or you probably know somebody that's been on it. And what they do nowadays, of course, this is just awesome. This is just perfection. But what they'll do instead of just kind of unplug, tearing you open each time, they actually just put it in a little port essentially, and they'll just hook you up, and you just walk in. And nowadays they have like little video and screens and stuff. You just kind of sit in basically like a dentist chair there, and you just kind of walk in. And they plug you in, and they just hook you up this machine, and you can see here blood goes in and gets cleansed through the machine, and then comes back out and goes back into your blood. Okay, you cannot stay on dialysis forever. It just takes its toll on your body. People that are on dialysis are usually awaiting a transplant. There are situations where people a chemical interaction or perhaps overdose or something like that, where they'll put them on for a little bit. But for people that are diabetics or have kidney problems, this is just a temporary measure. You have to get a transplant. Okay, so let's talk about the other parts, and then this is the end of the unit. So we've talked about the kidneys. All we've done up till now is talked about the kidneys. Okay. Oh, I got a diagram in here, right? This whole thing. So here's the ureter right there, and it's going to transport the urine down to the bladder. It is not. We'll get back to that. You can see here it begins at lumbar 2, goes behind the peritoneum in the base of the bladder. So it doesn't. So if here's your bladder, they don't go in through the top. They actually go around the back and enter from the bottom. You may remember something called the trigony, the three holes, the ureters, and then the urethra. Um, I don't know what this looks like, an alien or something. It's cool. That's awesome. Anyway, okay, that's terrible. Let's see. So what actually happens if you do a side view? Okay, here's your bladder. Okay, let's say you're facing that way. Okay, and so your ureters actually come down. Whoops, whoops. Actually come down behind it, and they actually fill up the bladder from the bottom, and the bladder will fill up from the bottom. Okay, and let me get rid of that. Sorry, and this is why. Okay, prevents backflow of urine to the ureters during bladder filling. If it just kind of filled in from the top, the urine would actually start going back up the ureter and then back up into the kidney, and that's destruction. You can't have that. That's going to destroy the kidney. The acidity will destroy the kidney. Okay. What's actually interesting, as the bladder increases in size, it actually shuts off the holes. That doesn't let more urine come in. And we've all been at that place before where it's like, oh my goodness, I'm gonna pop if I don't use the restroom. Yeah, you could actually. Hopefully, you shouldn't do that very often. The structure of the ureters, it's got three layers. It's got an inner mucosa, which we've seen before, like in the digestive system. Middle muscularis, which we also saw in the digestive system, and then this outer layer called the adventitia. That's the first time we've seen that term. You can see what it's made of. This fibrous connective tissue. It's protective and holds in place and all that stuff. But again, this muscularis layer, look at it. Look at the structure. Longitudinal and circular smooth muscle. The last time we saw that was with the digestive system. We saw it with the digestive system because that was peristalsis. It was the squeezing of the tubes, the squeezing of the food and drink. The ureters, although the ureter is here and the bladder's down here, you would think that urine just kind of falls down and drops into the bladder. No, it is active. It literally squeezes the urine down, and that's what these muscles are for. Okay, it's peristalsis. So the ureters actively transport the urine, like I just said, using peristalsis. It's not terrible. Um, when the ureters stretch out, because urine's in it, they will actually squeeze down. Again, kind of like your small intestine and large intestine did when there was food, chyme, and stuff in there. It's kind of the same idea, right? Now, it's actually this distension and stretching that's actually complicated. If you get a kidney stone in there, stuck in there, it's going to stretch out, and your ureters are actually going to clamp down on that. That's going to hurt. Okay, and that's where, if you've ever had a kidney stone or know somebody that has, they talk about this radiating pain. That's because it kind of off and on squeezes down on that stone. How often and how much the ureters will squeeze depends on how much urine there is. So you got a lot of urine, it's going to be a lot of contraction. If there's not, it's not. So it's pretty straightforward. Just kind of like digestion. Okay, so on the male, there's not much difference at this part, but you can see here, here's the ureter coming down from the kidneys would be up here, coming down, and then the bladder. And as I said already, the main difference is, of course, going to be here with the urethra. Okay, obviously it goes to the penis here with the male, and obviously not with the female. So the female one, there's the bladder. Do we even have the ureters here? No. Awesome. Anyway, there's your bladder. There's your womb, ladies, and the baby. Yeah, you could see why very pregnant women have a hard time not going to the bathroom. That big old child sits right there on top of that thing. And anyway, but there is the urethra there. Again, the urethra in a female is solely for urinary function. The urethra in a male is. So there's the ureters coming on down, and they come all the way down to here, all the way to the base of the bladder. And these two holes with this one make up this thing called the trigony. All right. And again, once again, the male urethra will go to the prostate gland, which you've all heard of before, and then basically your abdominal wall there. All right, let's talk about the bladder. Smooth, collapsible muscular sac that stores urine temporarily. Kind of almost sounds like the stomach. Of course, there's no digestion. Behind the pubic symphysis, males are, you can see what that is. And then part of it, actually, the prostate gland actually surrounds part of it. And we'll talk way more about that when we get to the reproductive system. But of course, that's another difference too. Females, you do not have a prostate gland. That's solely male. Females in front of the vagina and the uterus, and has openings for both the ureters and the urethra. Okay, so that's very similar. So again, the main difference is, of course, just the difference between men and women. It does have openings for this, and that's called the trigony, and that's the part that kind of gets stimulated if it gets full and tells you when you got to go pee and all that stuff. Okay, and unfortunately, it's also a common site of infection. All right, so once again, there's the three holes. There's the ureters, and then the urethra. Here's the big old prostate gland, and with the male, it goes through there. I guess I don't have a picture of the females. Oh well. You don't have to know this because it's basically the same. It's got three layers: mucosa, muscular layer, and adventitia, which is very similar to the ureters. It also has something that the stomach has these rugae. Those are the folds. When the stomach was empty, it had those folds in there that stretched out and allowed for extra space when food got in there. Well, the bladder does the same thing. Okay, without urine, you can see there it collapses into sort of like a pyramid shape, and as it accumulates, it expands, becomes pear shaped, and then you actually can feel it rising up in your abdominal cavity. Which again, if you've ever had to use the restroom really bad, you kind of almost can't even breathe. It'll hold about 300 mils without causing any sort of, you barely even notice it. 300 mils is less than a typical water bottle. And then eventually, once it gets to a half a liter, which is a typical water bottle, then you're going to start noticing it. It can burst if you stretch it out too far. Now, that's probably not going to happen under normal circumstances, but let's say you had like 10 glasses of sweet tea and you didn't want to use the public restroom. And so you're trying to get home as quickly as you possible so you can pee at home. And you get into a car wreck and your steering wheel jams into your abdomen and right into your right into your full bladder. Um, that could be problematic. So don't do that. Just suck it up and go to the bathroom before you leave the restaurant. And then finally, I told you this was quick. Finally, the urethra. The urethra, again, this is different between the male and female. Thin-walled muscular tube, um, same idea. It's got two stages around it, one that you have control over and one that you do not. The internal one is involuntary, and this basically is what keeps you from peeing on yourself at all times of the day, essentially. The external one is skeletal, and you have control over that, and this comes with basically becoming potty trained. Okay, so your rectum works the same way, an internal one and an external voluntary one. So your digestive system actually works quite the same way. Uh, there it is. See, there's the external one and the internal one. So basically, on a male, you can see the difference: one before and one after the prostate gland there. And then this is the best diagram showing the differences. What is pretty much obvious anyway, but just in case it wasn't obvious, there's the bladder, and then the part of the male that goes through the prostate gland there, and then the female, quite the difference. Not much else going on there. Basically, the bladder and out. Okay. With females, your urethra is about 3 to 4 centimeters long. That's just over an inch or so, maybe inch and a half. Tightly bound to the anterior vaginal wall by connective tissue. Its external opening, the orifice, lies in front of the vaginal opening and behind the clitoris. And again, it's solely urinary. So there it is there. And then you can see it where it is in relation to everything else. Okay. The vagina there and the clitoris up in front. Males, yours is a little bit more complex because it's got some more miles to travel. I shouldn't say miles, but it's got a longer distance to travel. Approximately 20 centimeters long. Now that begins back in the body, so nobody needs to be fainting or bragging or anything about that. But approximately 20 centimeters long and has three sections: the part that goes to the prostate, the part that goes through what's called the urogenital diaphragm. That's basically your wall between the inside and outside of your body, and then the spongy or penile, which is about 15 centimeters long. Okay. And it also goes to the urethral surface orifice, pardon me, but it also carries semen. Okay. The male urethra is both urinary and reproductive. The female is solely urinary. So there's the parts. There's the prostatic part, and then this little tiny section as it goes basically through your undercarriage there, and then out through the penis there. Okay. You can see also, so we've already mentioned the prostate several times, but all these parts, the prostate, the seminal vesicles, um, um, the seminiferous tubules, this is all reproductive stuff. And you can see that they literally, from the urinary system to the reproductive system, they literally intersect right there. And that's why just that part is actually part urinary and part reproductive. But again, we'll talk about all that stuff later. Same stuff. All right. So just quickly, we're gonna cruise through this, and we are almost done. So hang tight or not. Again, it's your video. You can do with your time what you want. Micturition is also known as peeing or voiding or urination, which nobody uses this word. As it accumulates, it stretches things out. Stretch receptors, again, it's um, very similar to your digestive system where it gets stretched. And then you can see the pathway here increases sympathetic outflow to the bladder. And all these different pathways there. Let's get to this part. When about 200 milliliters of urine is accumulated, impulses are transmitted to the brain where you feel like you've got to go to the bathroom, and then it'll keep getting worse. Like I really got to go, and then eventually, if the time is convenient, the you'll actually be able to actually pee. Of course, this part here. Remember this? The prefrontal cortex. Um, just can't pee anywhere. You got to have some sort of con- conscience, anyway, some sort of judgment. And so hopefully your judgment's working and you're not just kind of peeing wherever you feel like it. And then finally, um, renal calculi. These are kidney stones. I've always joked that calculus and calculi are basically the same word. And I've often felt when I was taking calculus that I was passing a kidney stone, or felt like I'd rather be passing a kidney stone than take calculus. Anyway, um, okay, different salts, different minerals, calcium, magnesium, uric acid salts, blah blah blah, and they crystallize and precipitate like snow or hail in the renal pelvis. That's the right near the hilus there. Most are very, very, very small, and you pass through without you even knowing it and without causing problems. However, the bigger ones can actually block up the ureter and block urine. It starts going down the ureter, starts squeezing on it because again we talked about that. It's going to stretch it, so it's going to squeeze, and then you get this painful, like your flank, the side, just this radiating, nauseating pain. It's usually accompanied by fever. It is unbelievably uncomfortable. You cannot get comfortable, and it comes in waves. And again, when your ureter closes in on the sharp rock, uh, um, that's when you actually feel the pain most. And so you can see up here, where's my thing? Up here, there's a stone. You may not feel it here, but once it gets here, okay, you can see how the walls are being stretched out, and then your ureter is actually going to squeeze down on that, and that's when you feel a lot of the pain. Okay, so I wish I was in front of you. I wish I was in front of you. I know you probably don't wish that, but I wish I was. This is not popcorn. These are kidney stones. This is a kidney that 4,504 kidney stones were removed. This is a man with really stretchy skin, and this is a man with hair coming out of his ears. That's it. Just extraordinary. These have nothing to do with anything except, well, kind of loses a lot in the translation when I'm not sitting there in front of you. What a way to end a year, huh? Sorry. Anyway, so there are people that are just predisposed to kidney stones, and if I was standing in front of you, I would ask, and there's usually at least one student that has or some, that has a dad that or uncle or aunt has had like thousands of kidney stones. Some people just get them, and for you people, you were excused. You should be drinking water all the time. Get rid of those things. Those are not everlasting gobstoppers. Those are kidney stones. They're really, really tiny though. I just blew them up to make them look ridiculous, but those look painful. And actually, what they'll actually do is you'll go to the hospital because you'll be in a tremendous amount of pain, and you'll beg them to do something for you. And they'll probably give you something to ease the pain, but then they'll give you a little strainer, and you're supposed to pee through the strainer to try to catch the uh, the stone, and then you're supposed to bring the stone back in, and they're going to take it and look at it, make sure that everything, other than you having a kidney stone, that everything about the stone is normal. I'm not making any of that up. If you don't pass it, then there are other things they can do. Oh, right here. So who's going to get it? Like I said, some people are just prone to get it. Frequent UTIs, urinary retention. So like every teacher in the world, high concentrations of calcium, which who knows, alkaline urine. So that could be diet or lifestyle. They don't want to cut you open anymore. They can actually put you in a giant bathtub and send shock waves at it and try to pulverize it, basically turns it into sand, and then you just pass that out. Worst comes to worst, though, they will. Um, but again, surgery is going to leave scar tissue behind, and that's going to make you more susceptible to more kidney stones because the stuff can't flow through properly. So surgery is not the first option. And then you can see you're encouraged to drink cranberry juice and other acidic things to keep the urine dilute and break the minerals down. So, not that you wanted to see me anyway. Oh man, has it been out of focus the whole time? Sorry about that. So, that's it for those notes. Just give me a moment on timeline and stuff like that. Don't worry about it. Just fill in the gaps, and we're not going to do live lectures anymore. I just don't think that was the best use of anybody's time. If you feel different, please feel free to email me. Let me know that you feel different. And if it's enough of you, we can do that. But I'll still be available online Tuesdays and Thursdays at 2, either through Google or Zoom. Since I'm not recording anymore, I don't know which one I'm going to use. It doesn't really matter at this point. Um, Probably Zoom. It's a little bit more user friendly. And since I'm not recording, it doesn't matter. Um, but anyway, um, so that's the urinary system. You've got video notes from Crash Course and some microscope drawings to do. I think that's about all the work I've got for you. I tried to find some labs and stuff, but there's just absolutely nothing out there, at least nothing that's usable. So anyway, if you have questions, of course, please email me. If you have comments, please email me. Please keep turning work in, doing a job, doing good work. When the due date's set, get it in there. If it's a day late, it's 20%. If it's a day late after that, it's 50%. So keep getting it in there. Put stuff in the Dropbox, pictures, PDFs, or Word docs, okay? Or even Google. You can put it on Google Docs if you want. All right. Take care.